My name is Jasmin Barrera. This is my central line dressing checkoff video. So I'm going to start off by looking at my physician orders. So I have George Green, MR number 824-65789, date of birth 7/15/19XX, no known allergies, and then I have 3 orders, all 3 at 0800. First is main central line placement. Central line sterile dressing change every 7 days or as needed. And then to notify doctor for any signs of infection, redness, tenderness, swelling, purulent or foul smelling drainage. Okay, so I'm going to start off by performing hand hygiene, stepping into my patient's room. Hi, Mr. Green. My name is Jasmine. I'm going to be your nurse for today. So we have orders from your doctor to change your central line dressing. Can I see your wristband for name and date of birth? Okay. Can you tell me your name and date of birth? Do you have any allergies? No? Okay. Do you have any questions about me changing your dressing? So we're just going to be looking for any signs of infection, and I'm going to be noting everything. If there's anything that the doctor needs to know, I'll be informing him. But we're just going to be changing out this dressing. It's going to be done every 7 days or as needed. Okay, so I already performed hand hygiene before stepping into the room. Now I'm going to put on my gloves. Okay, so for this procedure, whenever I take off that dressing, you are going to have to turn your head away from the central line, or you can wear a mask. Which one would you prefer? They prefer the mask, so I'm going to be giving them the mask that's in my kit. So I want to go ahead and open this up. And I want to take the mask out and my gloves. Okay? Now that that's out, I would be giving my patient this mask. They're going to put it on. Okay, so now I want to, again with my clean gloves, I'm going to assess the site. I want to assess for any redness, tenderness, or swelling, any other signs of infection, whether or not there's any drainage. Okay, I'm going to be looking at when it was last changed. Now I'm going to be I would have a tape to measure from the insertion site to the tip. I want to see if the central line has migrated out. I want to take note of the size, and then I'm going to compare it against what the previous nurse put. If it's longer than what the previous nurse charted, then it means that the central line has migrated out, and then we might have to check placement. Okay, so now that that's there, I'm going to go ahead and secure the biopatch. And I'm going to start taking the tegaderm off. Okay, Mr. Green, so I'm going to just be taking this off. And I'm going to try to just tug on it on the tegaderm. To make it easier to remove. Okay, so now I'm just going to remove this. Okay, Mr. Green, I know that was a little tough. How does that feel? Feeling okay? Okay, now I'm going to perform hand hygiene again, and I'm going to drop my bio patch into the sterile. So here, and then just drop it in. And now I'm going to be putting on my sterile gloves. Okay, get rid of that. Okay, now both my hands are sterile and I can start grabbing stuff from my kit. So I want to start off by grabbing the chlorhexidine. I would pop it, activate it. This is not going to be my dirty hand. I'm going to go ahead and grab the catheter, and then I'm going to scrub for 30 seconds. And then I want to go up and down the catheter. So I would scrub for 30 seconds, and then I would allow it to dry for 30 seconds. Okay, now that that's done, I'm going to grab the new bio patch, spread it a little bit, and place it there. Okay, now I can let go of the catheter. So I want to make sure that that's there. And then I'm going to grab my Tegaderm. And make sure to center it. Okay, we're almost done, Mr. Green, so I'm gonna go ahead and leave that there. Okay. Make sure that that's secure. And then I'm going to remove the label. I would write my initials, date, and time. And I'll place that on the side so that way the next nurse will know when the dressing was last changed. Okay, Mr. Green, how do you feel? Everything okay? Okay, so now I would raise the side rail on the side that I was working on. Lower the bed to its lowest position. I'm going to place the call light within reach. Okay, Mr. Green, so I'm going to step out of the room. I'll be back in about 30 minutes. If you need anything, please press on the call light. Feel free to let me know if you have any questions. So then I would get rid of all the supplies. Remove my gloves, perform hand hygiene, and step out of the room. And then I'm going to document, I want to document date and time, what type of dressing was used. I also want to take note of the length of the catheter, so that way the next nurse will know whether or not the catheter has migrated out. I want to take note, I would chart if there was any signs of infection, so any redness, swelling, tenderness. If there was any drainage, I would report whether or not it was odorless or foul smelling, and what type of drainage it was. And that concludes my video.